throughout residency or my training, I always liked doing hip and knee replacements because I felt like it was a repetitive surgery that you could do many times and kind of learn a systematic approach and try to perfect it and make it as efficient as possible. And you take a patient that has debilitating pain, is unable to get around, and their quality of life is significantly diminished, and it's no longer kind of a nuisance, but more of a disability type pain. And you can take them and really change their life to where they don't even remember that they had knee pain or hip pain before. And so that's what really interested me in hip and knee replacements. So knee pain in general, when a patient comes to us with knee pain, the first thing we'll always try to do is try conservative treatment options. So if you just hurt your knee and the pain goes away in a day or so, it's probably not a big deal. But if you have consistent nagging pain, then we'd like to get you to come into our clinic and see you and make sure that we try at least the conservative things first and take x-rays to make sure that there isn't a major problem such as a fracture or some cancer or something that's significantly bothersome. The first thing we would always have our patients do is try conservative treatment options like over-the-counter anti-inflammatory medications, Tylenol, a home exercise program, physical therapy, sometimes a knee brace, those kind of things. And so we start out as conservative as we can to treat a patient that has knee pain. Oftentimes it could be arthritis, or it could be a fracture, or it could be something wrong with the tendons or ligaments. When patients come in, almost all patients, a vast majority of patients are candidate these days to have their surgery done outpatient. For the most part, if you don't have any organ failure like heart failure, liver failure, or have a significant medical problem that the anesthesiologist is uncomfortable with, a lot of times we can do the surgery as an outpatient. And even patients that don't qualify for outpatient surgery in the surgery center, still, if they are doing well on the day of surgery in the hospital setting, they can still go home. The benefit to going home and getting out of the hospital is less risk of blood clots, less risk of pneumonia, less risk of getting sick from the patient that's in the room next door to you. There's infections that can happen from the hospital. So, and a lot of people like recovering in their home. And I think it's good to get people to get out of the hospital as soon as possible because they're kind of forced to get up and get moving around, and patients like to get out of the hospital. And so outpatient surgery is a great way to go. And I do think it is really changing the way that we do things. The way that we like to do that is we always tell a patient that we would like you to have a friend, family member, or neighbor available to you 24/7 for the first 5 to 7 days after surgery. We also have the option of home health, where physical therapists can come to your house at least 2 times a week, and sometimes up to 5 times a week if the insurance will approve it. And they can be there and help you work with knee range of motion or just mobility if you had a hip replacement and getting around the house in a safe manner.